Hello and welcome to Connect and Collaborate. I'm Alex Hopkins, your on-air producer, and I'm very excited because I have in studio with me AJ Diamontopoulos. He is the manager for Accountable Health Communities, and Kirsti Klaverkamp. She is the coordinator for AHC. Again, that's Accountable Health Communities, along with DRCOG, that's Denver Regional Council of Governments and Area Agency on Aging. So we're going to have some acronyms to flow through this next half hour. But first of all, I want to take a time out to congratulate you guys. You just won our Champions in Industry Awards in the government category, so congratulations on that.
Thank you very much.
Thank you. We appreciate it.
Yeah.
Yes, of course. What did you think of the event? Did you have a good time?
I did. I thought it was wonderful.
Yeah, it was spectacular. Very well organized and entertaining, to say the least.
Good.
And,
that room was great, too.
It was mostly so we could pat ourselves on the back. Just kidding.
You deserve an award for that award, too.
Thank you. It was our second annual Industry Awards, and I really enjoyed it. And our speaker was really great. Reggie Rivers was awesome.
Yeah,
Yeah.
he was incredible.
We weren't sure what to expect ever when we book our speakers, but he did a great job.
Yeah, he did.
Congratulations again, though, on that win. You guys had some big other entities that you were up against, and so. But again, Covert Colorado Business Roundtable had no bearing on. We were not allowed to judge. Exactly, we hired third party, so it was not swayed by any means. But let's get started here. So we'll start off big picture with DRCOG, and again, that's Denver Regional Council of Governments, and which DRCOG I think is pretty clever. How did that come about?
You know, I'm not sure, but we used to have little, what are they called, marketing tools. It was a little doctor, and his glasses said DRCOG. It gets a little confusing now that Kirsti and I work in healthcare with a lot of healthcare partners. We get a lot of emails that say, like the subject line will say DR.COG.
Yeah. We'll get calls asking to speak to the physician or the medical provider, and we have to explain. We do have actually several doctors and PhDs in the house, but not that sort of.
No DRCOG, exactly.
Yeah,
correct.
I love that. Well, you know what? I got into it too soon. I actually want to hear a little bit about each of you. So, AJ, I'll start here with you. Tell me about your education background, how you ended up at AHC. And
Sure. It's a long story, as it always is. I'll start. I was working in the Area Agency on Aging in 2013. I was what they called a care transitions coach, so I was working in hospitals on another project helping older adults avoid a needless readmission back to the hospital. And that program ended, but I was getting my master's degree from the University of Denver at the time. And our director, Jayla Sanchez-Warren, took all the staff there and moved them to different positions, and she moved me into business development. And I worked for a couple of years there when I came across the application for the Accountable Health Communities funding from the Centers for Medicare and Medicaid. And normal funding announcements are, pretty comprehensive. They're like 30, 40 pages. This one was 123.
Whoa.
Yeah, and so it took a while to read through, but it was exactly where we wanted to be as an organization, moving into what they call the social determinants of health, and partnering with healthcare providers to help the people we're responsible for in our region to be healthier and live healthier and happier lives. So it was really surprising that we were given the award, only because the competition was so stiff. You had to get the partnership of the state Medicaid agency, the horrible acronym called HCPUF, and we learned that there were 38 organizations that were thinking of applying, and these were very strong healthcare and human service organizations, but only 2 actually applied from Colorado, and both of us were given the award, so it was very exciting. Nice segue away from talking about me. But there was a year lag between our application and when we eventually got the award. And during that year, I continued in business development, building partnerships with our clinical partners in the region. And then when we were given the award, I was moved into the manager position, having helped our partners design the application and the overall project. It was pretty cool. It was really cool
yeah, there you go.
to take it from the beginning and see it and come all the way to fruition. And I always laugh because we were supposed to hear about the award in March of 2017, but that is when all the political drama ensued about the Affordable Care Act. And so we got this cryptic email from the Centers for Medicare and Medicaid that said, we've decided to delay the announcement of the award for a month. And I was the only one who was like, that's not a bad thing. They just want to be thorough. And everybody's like, yeah, it's going away. But then John McCain gave his famous thumbs down, and a few weeks later we were given the award, which was pretty cool.
That is pretty cool, and I like that you stuck out with your hopefulness there.
Yes.
You were adamant. You got your team rallied up, hopefully, on that one.
Absolutely.
So, Kirsti, tell me about your career path here, and why AHC?
Why AHC? So way back in my undergrad, I had started thinking I wanted to go into medicine, actually. Was pretty adamant about it, that I wanted to work directly with patients, and then that was kind of the path that I was leading for myself. But before pursuing higher education, I decided to take some time off, and I worked in direct services. So I worked with patients and client more on the social side, getting them connected to healthcare services, getting them a little bit of healthcare literacy, getting them connected to community-based services, social services, all of that. And through that work, I decided while that is essential for overall health and well-being, I realized I wanted to work on more systems level change. And so at that time, I had transitioned to work for DRCOG and started my master's in community health, so I could work more in that kind of sector of community health rather than direct services, more of the administrative side. And so I just actually finished that degree up, and it's gone hand in hand really well with the AHC already to kind of say and understand that all of this work at the patient level needs to happen, right? But if we want to move forward and, kind of look at problems in new ways and come up with solutions like the AHC, we need to bring together different partners. And so that's kind of where my career trajectory has gone. I started working directly with patients and clients who will always be near and dear to my heart, but now I am kind of focused more on this larger sort of level systems change, working across sectors in that work. And so I'm here today on the AHC, and I love it.
Yeah, wonderful. And I'm a huge proponent for people taking some time off before going into school and perhaps getting out in the workforce and seeing what you want to do before you jump into a 4-year degree or a 2-year degree and spend some money.
Exactly.
that you won't get back, right?
Exactly.
And we should take a moment to celebrate that Kirsti just finished her final project, so she's
I did.
Done,
I successfully defended.
Yeah.
Yeah. So it's been a big
Very
fall
exciting.
for the AHC and personally.
Wonderful. Well, congratulations on
you.
that. Yeah, that's tough to do, but you got through it, and wonderful. And it seems that you're doing very well with AHC and working on the team amazingly. So let's talk about. So you did win the award. AHC did. So highlight the initiative for us, if you don't mind. I know that you briefed over it just a little bit, and you talked about how you had the year gap in between getting the AHC initiative, but let's walk us through after we got the award, where we've been.
Where we've been. Okay. Well, I think I'll start with a quote that came from, I believe, the Robert Wood Johnson Foundation, and it was part of the original funding announcement from the Centers for Medicare and Medicaid. And it's very telling about the state of healthcare and overall health of our community. And it's basically, of the underlying modifiable determinants of health, 30% are healthy behaviors, 10% are the physical environment you live in, and healthy behaviors being like smoking, regular sleep, things like that. 40% are social and economic factors. Are you socially isolated? Are you lonely? Do you have enough money to pay your bills? And the last metric is 20% is due to clinical care. So yes, if you get a cold and go to the doctor, they might give you a prescription. Well, probably not for a cold. I'm not a doctor. But if you have something wrong, you go to the doctor, you get fixed. But that's only 20% of your overall health and your modifiable variation of that health. And so when you look at the accountable health communities, it's basically testing what is the impact of addressing 5 of a multitude of social needs. And the impact being the very real cost. Does it reduce the cost for the center, or for Medicare and Medicaid, so ultimately the taxpayer? And does it improve quality outcomes? Now, quality is a catchword in healthcare, but does it, if you go in to the hospital with a heart attack, you're going to have a decline in your health. But do you either maintain that coming out, or does it improve? If it goes down, that's a negative quality outcome. But there's if you can maintain or improve, that's a quality outcome, and that's one of the things we're looking for. And that's what is the paramount goal, is to understand how helping somebody who is food insecure or has a lack of transportation, how do those providing those services, how does that impact their outcome or the cost of care? Everybody knows it has a positive effect. Nobody knows how. So we're trying to figure out what is the mechanism that creates that positive effect and lowers the cost and improves the outcomes. So basically, it's a very complex project. I was fortunate enough to be naive and not know how complex it was when we were applying. But we need to screen a minimum of 75,000 Medicare and or Medicaid beneficiaries per year for 3.5 years. Of those, if someone has a need and reports that they have 2 or more emergency department visits in the past 12 months, they are provided a navigator if they so choose. This is all voluntary. Nobody's enrolled against their will. And they're given the choice to get some help connecting with the community service organizations that can address those needs. And so those referrals go out, and it's a network that we've created. And so the community organizations provide the service, and they tell us what services those clients provided, and that's how we're able to, through data analysis that I'm in no way able to explain, figure out what is the cost and outcome result.
Yeah.
On top of that, it's a quality improvement exercise. So figuring out, it's one thing to say screen people and send them to community services, but how do you do that, especially in a clinical setting that may want to do it and may have some version of doing that, but doesn't have an overall structure in place. So we're building that structure and building that referral network with them. And then they're utilizing it, and then we're connecting people through our advisory board and through a multitude of ways. One of the first times in an organized fashion, we're connecting the community and the clinical provider together to talk about these issues at the bigger level, and figure out how to overcome barriers. And the hope is that that becomes the integration of the clinical and the community side, so that we can continue to work together even after the funding from Medicare runs out.
Wow.
Yeah.
That's amazing. Yeah, so there's a lot going into this. And you mentioned, again, 75,000 Medicare beneficiaries.
Beneficiaries,
okay,
yeah.
Thank you. A year for 3 years minimum that you have to get screened.
Mm-hmm.
Has that proven a little tough for you?
Just a little.
Okay. Well, and again, I don't have a number in front of me, because we are speaking Colorado specific, right?
Yeah, and this is so there are 2 AHCs in the state. We're in 6 counties around Denver, the 6 most populous counties. But the 75,000 number is large. But the important number, and I'm not sure I put a number on it, is the number of navigation cases is 3,000, and that's the number we have to reach each year. And we're pretty close to that. We're close to being on track. There's always startup issues.
Of course.
What we've learned, actually, we just got back from the national conference. So this AHC project is nationally funded by the Centers for Medicare and Medicaid Innovation. So we're one of about 30 of them. And so what we all found when we got around the table in Baltimore for this national conference is, yes, the screening number is huge, and we're all ramping up to meet that number. But we're all sharing this realization that while CMS, Centers for Medicare and Medicaid, evaluated and estimated, how many people would be high risk, those necessitating navigation, while they estimated that number, we're seeing it almost double what they estimated. So,
wow.
Yeah, so it's been interesting to see it play out, and kind of show that this definitely is a service that's needed in the clinical and community based worlds. And so, Yeah, we're definitely ramping up, and it's been a little bit comforting to talk to all the other project managers and coordinators to be like, we are in this together, and we will get to those numbers, but very also like validating to say like this work is definitely worth it. We're reaching the people who definitely need it.
Absolutely.
Yeah, that's amazing. I love hearing that. I'm going to switch gears a little bit on you guys here. And we know that the AHC funds the building of the infrastructure to implement a screening tool for this, but doesn't fund the actual services that are provided. So I'd imagine there's a bit of a gap there. Just a small one. How do you guys bridge that?
Yeah, that's a really great question. So this project is such an incredible opportunity to demonstrate what we've known, what we've alluded to for years, that these community-based services really does make a difference in individual health and well-being. And while we got a very generous grant from CMS to do all this building and networking and systems change, you can't necessarily demonstrate the impact that a service has if someone is only being referred to a wait list. And so that is something that we have had a lot of internal discussion about, and it's something that we wanted to address. And so after getting the award for the AHC, our director immediately said, what's next? How are we going to solve this gap? And so in doing that, we are really fortunate that the Next 50 initiative was founded. So they are a foundation who looks for innovative projects in the community that are bringing together different partners to make those next 50 years of life, so it's for adults 50 years and older, just as healthy and meaningful as the first 50. And so we applied to the Next 50 Foundation. We had already had some time underneath our belt to say, these are the partnerships we've created. We've already created some infrastructure. This is a really promising project. And through that, we were awarded a grant through Next 50 initiative to help fund some of these services. So when we're working with patients and clients who are 50 years and older, our partners can not only identify their needs, but now there's a funding stream to provide food, transportation, utility assistance almost immediately. And so we'll be able to say, this person was referred, they got the service, and look at the difference that it make in a more tangible way. So
and I do want to interrupt and call out for a second that Kirsti wrote that grant, and it was very competitive. It was the Next 50's first funding cycle, and she did a great job connecting us with the Next 50 and getting the successful award. It was pretty cool. It is a huge gap to say, all right, connect these people with these human service agencies that are already overwhelmed. And so to be able to provide them extra funding to pay for a unit of service is really a very positive thing.
Oh, yeah, that's phenomenal. Well, and you are just winning all over the place, aren't
Absolutely.
you?
It was a team effort, like everything the agency. I appreciate that. It's definitely a team effort.
Yes, but writing those grants are not easy.
No.
I've seen that, and that process is harrowing, to say the least. But I imagine that you went through a little bit of a happy, sad moment. Yes, we got the grant from AC, and then we still have money that we have to find somewhere else. And so then you had to revamp and write another grant. But it's turning out to be really successful for you guys. That's awesome.
Yeah.
Thank you.
Yeah, of course.
There was that moment of celebration. We got the initial award, and we were literally jumping up and down in the office, and then it slowly dawned on all of us, oh, we actually have to do all that.
Yeah.
Oh.
Now it happened.
Now what?
Yeah, right? The holding and baiting your breath
Right.
was only a little bit of the work that you had to do when you were awarded that. So what other successes have you seen thus far with AHC and after you got the grant? What other successes?
Yeah, so we're 7 months in now of operating. So we had a year of planning and then 7 months of operating thus far. And I think, AJ mentioned this is a quality improvement plan. So we're constantly thinking, what can we do better? How can we make this more efficiently and effectively? But I think it's moments like these where we step back and we realize that we have had successes already. And I think that keeps us motivated. And I can point out to successes both on the clinical and community side. Some of our clinical partners have already voiced to us that this project has brought their teams together. That they not only have this screening tool to better, identify their patients' needs, but a process to address them and community partners to refer to, so they're not afraid to ask the questions anymore. And so that's been huge for us. And I think success, yes, to get started, but also, lays the groundwork for future successes. And in terms of the community side, because of all the data that we're collecting, we're keeping track of the patient's story. And what I mean by that is, we know what their need is, we know where they're being referred to, and we can tell whether they start services or not. And when they don't, we can investigate that and figure out why. And so with that information, some of our community partners are already changing the ways in which they take intake, in which they get people signed up and delivered services. And so I think while we know the value of those services already, they're already working on improving that. And so I think that's already been a success. And on a more individual level, we've already heard success stories from our navigators. It's no secret that we're in an affordable housing crisis right now in the Denver metro area. And yet through these connections, some of our navigators have found housing. And I'm thinking of one individual in particular. He was struggling, was not in affordable housing. Therefore, he couldn't pay for his groceries. He was past due on his utility bill. And that kind of catapulted and escalated all of his healthcare problems. Within a couple of months, this was a true success story. She found him housing, and so now he can not only pay his rent, but he's on top of his utility bill. He has food in his refrigerator now. And so, we're talking this large systems level change, but we're not forgetting what it means on that individual level. Like, it really is making a difference. And so, yeah, I think that's what's keeping us going. In the days where we're like, okay, what else can we do better? We step back and we say, okay, this is working.
Yeah, wonderful. What a beautiful story to share, and thank you for that. I was going to ask a personal story, and you beat me to it. I love that. Hearing about that's amazing. So ultimately, we've touched on it a little bit throughout the interview here, but AHC is going to change healthcare.
We hope.
Yeah. Give me some more thoughts. Thank you.
No, I'm
That's
good.
a great.
We hope.
Okay, we hope. All right.
Well, I started off with that quote about the modifiable variation in healthcare, and it is we are in a very tangible and real way bringing to the table the fact that people don't exist in their clinical provider's office. They have a whole life. It is I lived in. Anyway, these are whole people. They have families. They have jobs sometimes. They have needs and desires. And just by, giving them a prescription to address one part of their healthcare doesn't necessarily mean they're healthy. And figuring out how we can tell the whole story of a people and a community and a region of, like, this is what health is, and here's how we help our fellow citizens to address some of their needs so that we're all better off for it. It's very pie in the sky there, but it is possible to understand that community health is one of the most important parts of a person's life. And not only getting, the nuts and bolts data of understanding what is that interplay of community services and healthcare services, that's very important. But overall, how do we raise the bar on how we define what our community level of health is? So as one of the titles that we get at DRCOG for receiving this funding is the integrator. We are integrating the community and the clinical services into one. And that is the overall long-term goal, is to figure out how we can design a care team that that includes both the clinical provider and the community service provider to address somebody's overall needs, to help them through a short crisis or a long-term crisis, so that they can have a certain baseline that this is as a community, we're not going to let you fall down anymore. We're going to help you out because we're all in this together. Because we all, if with Medicare and Medicaid, we all pay taxes for that, and lowering the cost of care improves, and there's also improves the value for all of us. But there's also social benefits to all of us, and so to make a very vague and broad point, the point of the AHC is to figure out how we can serve people more holistically and more appropriately to address not just their healthcare need, but their overall need.
That is wonderful and beautifully said. And you made a joke about it being pie in the sky, but I think your hope is really backed up. Yeah, I do think you've got some great initiatives behind you. I hope this is very successful and we continue to see more from AHC, and maybe you'll win some more awards along the way and get some more granting. So again, congratulations on your winning our award, the Champions in Industry and Government category. And it has been a pleasure having you both on. Thank you both so much.
Thank you so much.
Well, thank you so much.
Yes.
Thank you for the award.
Of course. Have a wonderful day.